So now we are going to go through the steps of removal. And before you start removing, we have our drip running. It can be normal saline running. And then you check and ensure there is no more bleeding. And then you take your vitals again, the blood pressure and the pulse rate. So what's our blood pressure right now? 123 out of 87. So you can use the rule of 100 or the rule of 20, whichever you're conversant with. So the rule of 100, your blood pressure should not drop below 100 millimeters of mercury, and your pulse rate should not increase beyond 100 beats per minute from what you have taken before you start removing. If you're using the rule of 20, your blood pressure should not drop by more than 20 millimeters of mercury from the baseline that you've taken, and your pulse rate should not increase by more than 20 beats per minute from the baseline that you've taken before you started removing. So the choice is yours, or whether to use the rule of 20 or the rule of 100. The whole point is your systolic blood pressure should not be more than your pulse rate at any one point of removal, because that is what gives you what we are calling the shock index, and this is the anti-shock gamete. So at any one point, your systolic blood pressure should not be more than your pulse. Okay, so we start removal from where you started application. And in between each segment, you wait for 15 minutes of redistribution, take the blood pressure and the pulse, and then you move to the next segment. So we don't rush. You know that removal is going to take another 45 to an hour. So we remove segment 2. Okay, we remove starting from where we applied first. Segment 2. We wait for 15 minutes, and then we take our blood pressure and the pulse. Okay. How are you feeling? She's okay. We are not bleeding. The caution here is you wait 15 minutes between each segment for redistribution to happen before you take the vitals. Okay, so we are assuming we've taken the 15 minutes. 120. Okay, our pulse is below 100. We are using the rule of 100, and our blood pressure is more than 100. So we can move to segment 3. Okay, so you remove per segment, not per side like we are doing. Segment 3, we wait 15 minutes. Again, we take our blood pressure and the pulse. We're using the rule of 100. Blood pressure. Okay.
Pulse rate 68.
Okay, we see that our pulse is dropping, 68, so we are still below 100. So supposing our blood pressure had dropped to 90, we would put back all the segments, 3 and 2, and then increase the IV fluid flow. Okay, we check for bleeding, we palpate the uterus, but our vitals are stable, so we are going to continue and remove segment 4. Segment 4, again 15 minutes of waiting for redistribution, and then we take the vitals again. Check on our patient. How is she feeling?
Okay.
All right, patient is even smiling. All right, so we'll remove our last segment and we document our final vitals. All right. The uterus is well contracted. All right, so we take our vitals.